Hi, I'm KJ, a foot and ankle orthopaedic consultant at the Midlands Orthopaedic Centre, Dudley. You've broken the tip of the outside ankle bone. This common injury generally heals on its own. Pain and swelling can last for 3 to 6 months. Swelling is often worse towards the end of the day, and elevating the foot will help. You will be given a boot in A&E. The boot you have been given is for comfort only and is not needed to aid fracture healing. It normally takes 6 to 12 weeks to heal. Medical evidence suggests that smoking prolongs fracture healing time. In extreme cases, it can stop healing altogether. Stopping smoking during the healing phase of your fracture will help recovery. We do not routinely follow up patients with this type of injury. If after 6 weeks you're still experiencing significant pain and swelling or struggling to manage without the boot, please do not hesitate to contact the fracture clinic for further information. A few words about rehabilitation. Week 0 to 3, we recommend that you wear the boot all of the time when walking. It is okay to take the boot off at rest. Use crutches to take some weight off your foot. Start ankle and foot exercises straight away to maintain and improve your movement. A cold pack can provide short-term pain relief. Apply cold pack to the sore area for up to 15 minutes every few hours, ensuring the ice is never in direct contact with the skin. Weeks 3 to 6. Try to stop using the boot and walk without crutches. Start around your own home at first. You will want to wear the boot if you go on longer walks. Continue with the exercises to regain flexibility in your foot and ankle. Week 6 to 12, your injury has healed. You may have mild symptoms for 3 to 6 months. You can begin to resume normal day-to-day activities, but be guided by any pain you experience. Heavy tasks and long walks may still cause some discomfort and swelling. Thank you.
Hi, my name is Deanna Evans and this is my colleague Vicky Hawke. We are senior physiotherapists working as part of the fracture clinic team at Russell's Hall Hospital. We are developing a series of videos to help patients remember the information and advice provided by clinicians. Research shows that only 10% of information given at an appointment is retained, so this video should help our patients remember the advice given. One of our consultants has guided you through the information about your injury and how this is managed initially. Then one of us will help you with rehabilitation and recovery advice.
I shall now guide you through some information and advice regarding the rehabilitation of your limb injury. In this initial phase, 1 to 7 days of recovery, it is important to manage swelling and acute pain. We therefore advise you have relative rest of the injured area. This doesn't mean you have to stay in bed, but avoid strenuous repetitive work and activities and rest the affected area as much as able. Swelling is a natural part of the healing process, but it is important to manage excess swelling of the injured site. Ice and elevation can help manage this. To help manage swelling and pain, we advise you use an ice pack, for example a packet of frozen peas or ice cubes in a plastic bag. Wrap the ice in a damp tea towel and place it over the affected area of your injury as shown. Make sure ice does not come into direct contact with the skin. This will minimise the risk of any ice burn. Leave the ice pack in place for 10 to 15 minutes, no longer than 15 minutes though, and you can repeat this 4 to 5 times per day. If you have Raynaud's disease, peripheral vascular disease, impaired sensation affecting the area, or you have been advised against using ice for other medical reasons, do not use. Elevation of the affected area can also help with swelling management. To do this, rest the limb on pillows and ensure the area is elevated higher than the hip as shown. Try to keep the limb elevated whenever you are sitting or resting as needed. It is important to regain the natural movements of the affected area as early as healing allows. You will gradually find you are able to use your foot and ankle more and more normally as time passes. You may get some intermittent pain with certain movements for some time. It is important to remember that it can be normal for your ankle to not fully bend, straighten or rotate. Simple active range of movement exercises as comfort and pain allows will help reduce stiffness of the ankle and help prevent a blood clot. In this instance, we would recommend you start the following exercises immediately. With these exercises you should feel a stretching sensation, but do not push into pain. For each of them, perform 10 to 20 repetitions, 3 to 5 times throughout the day within comfort levels, progressing the number of repetitions as tolerated. Sit with your leg outstretched in front of you. Moving at the ankle, bring your foot up towards you and then point the toes and foot down. Sit with your leg stretched out in front of you. Moving at the ankle, turn your foot inwards, then out, without moving the leg. With this next exercise, you should feel a stretching sensation, but do not push into pain. Hold the stretch for 20 to 30 seconds, then relax a few moments and repeat 4 to 5 times, 3 to 5 times through the day. Sit with your leg outstretched in front of you. Loop a folded towel or belt around your foot. Keep the foot and leg relaxed. Pull on the other end of the towel so your foot is pulled towards you. You should feel a stretch of the back of the calf and ankle. It is important to progress the exercise as your injury heals. Start the next stage of exercises from 3 to 6 weeks post-injury, as long as the previous exercises have become easy to do and you have been told you can fully weight bear. With this next exercise, you should feel a stretching sensation, but do not push into pain. Hold the stretch for 20 to 30 seconds, then relax a few moments and repeat 4 to 5 times, 3 to 5 times through the day. Standing, leaning with your hands on a table or against a wall, place your unaffected leg in front, with your affected leg about a pace or 2 further back. Lunge forward onto the front leg, keep the back heel on the ground and your knee straight. Feel the stretch of the back of your ankle and calf, and you may feel a restriction or pulling feeling at the front of the ankle. If you are able to do this exercise, you can stop exercise 3. Stand with your feet shoulder width apart, feet parallel. Hold onto a surface if required. Then keep your heels on the floor and bend your knees to do a small squat. You should feel a stretching in the calf and may feel a restriction at the front of your ankle. This is normal. Repeat 10 to 20 times as comfort allows, 3 times per day. If you suffer from any existing knee problems and this exercise causes any knee pain, do not do it. Balance is an important function of the foot and ankle, and it is important this is rehabilitated after a lower limb injury. If you was unable to balance on one leg easily for 20 seconds prior to your injury, start with the following exercise. Stand with one leg in front of the other as though standing on a tightrope. Keep your balance for 20 to 30 seconds and repeat 3 to 5 times. If you feel too unbalanced, hold on lightly to a wall or table. Practice this little and often through the day and keep alternating which foot is in front. As this improves, or if you could stand easily on one leg prior to your injury, progress on to the next exercise. Stand on the affected leg, lift the other foot off the floor and keep your balance for 20 to 30 seconds. Hold on lightly to a wall or table if you feel too unbalanced. Practice 3 to 5 times in a row, little and often through the day. As the single leg balance exercise gets easier, you can make it more difficult by performing with your eyes closed or throwing a ball up and down in the air. Repeat again for 20 to 30 seconds, 3 to 5 times in a row, little and often through the day. Start these exercises 8 weeks post-fracture, as long as you have worked through the other exercises easily. As you continue to improve your movement and are recovering from your injury, you can progress onto more specific strengthening exercises. Make sure you have warmed up the area by doing exercises 1, 2 and 5 prior to these. Stand with your feet shoulder width apart, hold onto a surface for a little support if needed, then raise up onto your tiptoes as far as you can control and is comfortable. Then lower the heels again. Repeat 3 sets of 8 to 12 repetitions, resting for 30 to 60 seconds between each set. You only need to do this once a day, 3 to 4 times per week. Following this exercise, perform exercise 3 or 4. It is normal to get some pain and discomfort when you exercise, and this may take anything up to a few months to settle completely. However, it should not be severe pain, and any pain after exercising should be bearable. Your joint should not feel hot, inflamed, or develop lots of swelling after exercise. If your pain following exercising does not settle down within 30 minutes of exercising, you should consider the following. Do smaller amounts of exercise. Do not push through high intensity pain. Discuss your pain relief with your GP. If there has been an increase in swelling, use the ice and elevation advice. If you still find your pain severe or unmanageable, or are concerned about the lack of improvement, please contact the fracture clinic. You should be able to return to simple, light household tasks from 2 to 3 weeks post-injury. Heavier or more repetitive tasks will take longer, usually 8 to 12 weeks. Returning to low-impact upper limb exercise, such as swimming or riding an exercise bike, would be advised from 6 to 8 weeks. Higher impact sports, for example tennis or cycling over rough terrain or downhill, is likely to take longer, from 12 weeks onwards. These timeframes may be longer depending on pain or stiffness. If prior to your injury you participated in non-contact and low-impact sport, for example swimming or riding an exercise bike or gentle cycling, you should be able to return to these from 6 to 8 weeks post-injury. Returning to running and contact sport, for example football, rugby or hockey, is likely to take longer, usually at least 12 weeks. This should involve a gradual reintroduction of training first. If there are no increase of symptoms with returning to training, gradually increase the training to return to sport. Finally, although the information in this video is based on current knowledge and best practice in managing typical conditions, all individuals and injuries are different. This may mean your symptoms do not follow a normal predictable course. If this is the case and you have any concerns, please contact the fracture clinic.